The currently approved COVID-19 vaccines to date are approved for ages 16 and up. Shortly, we expect clinical trials, including phase 3 clinical trials, to be completed for age 12 to 15 and subsequently younger age groups, 6 to 12. This is not unusual at all. In fact, every time that we have a new vaccine that's approved, the safety is first established in adults and the efficacy, and then pediatric trials begin. And we're seeing the same thing happening live with the COVID vaccine. A person's immune system really matures from infancy throughout childhood and adolescence into their adult years. So we can't just extrapolate a lot of the data we have from the adult studies. A child's immune system behaves a little differently than that of an adult when we see it fight an infection. And a good example of that is when we vaccinate babies against something like tetanus. Initially, we give them a bunch of doses clustered together before they're spaced out and then routinely maintained in their adult years. So a child's immune system can show a very different response to vaccines than a grown-up. So far, we have reason to believe that the COVID vaccine will look quite similar in the 12 to 15 age group, and hopefully the same will hold true for younger age groups. But without a clinical trial in pediatrics, it's hard really to anticipate the response to vaccination that kids will show. Kids make up 20% of our Canadian population. So until children are fully immunized, we don't expect full herd immunity. So it's anticipated that with phase 2 and phase 3 of the rollout of the vaccines, children will begin to get immunized and they will help us to establish herd immunity. But until that time, until the vaccines become available for children and we have herd immunity, we look first and foremost towards our public health measures that exist to date, being physical distancing, masks, hand hygiene, and for those that can get the vaccine, get the vaccine.